For anybody watching this for the first time, they say, okay, I see why Fortune 500 major film and TV productions need to incorporate this now. We get all the reasoning. Why would they go to Bloom Health Partners? Why wouldn't they go to Georgetown Medical, some big American conglomerate, or a bunch of big American conglomerates? What's your answer to that as to why you guys are able to get in the door?
We're willing to innovate. I think that's the biggest thing. Traditional occupational health, and you called it out earlier, this is, I don't want to call it a boring business, but it hasn't changed in a couple of decades.
Yep.
And traditionally it has been the equivalent of what I like to call a school nurse. Somebody hurts their elbow, they go to the medic, and that's what they do. So they don't really associate the medical component of occupational health within a company with the confines of your office or your factory as a positive experience. It's kind of, it's where you go when things are bad. But if that place is associated with things like preventative care, this is a company that's taking care of me because they're actually screening me for other kinds of potential illnesses like diabetes, which is another epidemic on its own. Type 2 diabetes, unfortunately, is a major problem in the United States. 40% of Americans are considered obese. These are major indicators for longer-term critical illness. If an employer is taking care of their employee, now the employee has a better thought pattern to, hey, this is an employer that actually cares about me. I want to work here. I have my choice. I can make $15 an hour here or there. I think I'm going to go with the place that actually takes care of me. And I think that's what differentiates Bloom, because we're willing to layer those kinds of services. The bigger piece is that all of that information that's collected, obviously it's private information. You can't know individual data, but what you can know is overall stats on what's the viability of my business. Here's all my employees. They're all working hard and all of that. I'm screening everybody. I can't know that Fred over there has diabetes and Sally over there has, potentially cardiac disease. But what I can know is what the risk is. How much risk is coming out of this organization? And then what do I have to do, from changing the vending machines all the way through to wellness programs? How does a business owner do that? And that's what differentiates Bloom's strategy versus, I think, pretty much everybody else in healthcare right now.
If you love that clip, give us a like, then hit the link to watch the full video. Don't forget to subscribe.